of the regional media who have joined us virtually for this media conference. May I introduce you, though, to the members of the head table. Dr. C. James Hospitalis to my immediate left, to your right, who is the Executive Director of CARPHA. And next to Dr. Hospitalis is Dr. Babatunde Olawokure. He's the Director of Surveillance, Disease Prevention and Control here at CARPHA. And I am Colin Curtin. I'm the Communications Manager at CARPHA. Ladies and gentlemen, at this time I would like to go straight into the proceedings, and I would like to invite Dr. Babatunde Olawokure to address you on the Ebola virus disease. However, I'm sorry, Dr. James Hospitalis is the one who will address you on the Ebola virus disease, and I turn you right over to him. He will be speaking right from the head table.
Thank you, Carlon. Members of the media, invited guests, good morning. Thank you for joining us at today's update on the global and regional situation as it pertains to Ebola virus disease. As many of you are no doubt aware, there is currently an outbreak of Ebola virus disease, or EVD, affecting 5 countries of Western Africa: Guinea, Sierra Leone, Liberia, Nigeria, and Senegal to varying extents. This outbreak is the largest in the history of the discovery of Ebola, since the discovery of Ebola in 1976. Currently, there are reported 4,293 cases and 2,296 deaths as of September 6, 2014. Our hearts really go out to the people who are affected by this problem in West Africa. Separately, there is an unrelated outbreak of Ebola virus in the Democratic Republic of Congo with a different viral strain, where 24 persons have been infected and 13 have died as of the last available update, which is August 27th. In the light of the World Health Organization's declaration of the West African outbreak as a public health emergency of international concern, and bearing in mind the concept of a global village made really by international travel very rapidly, the Caribbean Public Health Agency, CARPHA, seeks to keep the population of our 24 member states abreast of the developing situation, of its relevance and the potential impact to our Caribbean region, and the mechanisms being put in place to mitigate such impacts. What is the Ebola virus? The Ebola virus, or a group of viruses which cause illnesses associated with very high fever, severe weakness, and often bleeding complications and death. Because of this, these diseases are frequently referred to as viral hemorrhagic fevers. The Ebola virus in particular is associated with a high case fatality rate that can be as high as 90%, although the current outbreak is around 50%. 53.5 is the current tally. This virus originated in the forests of Central Africa and has the fruit bat as a host. It circulates among other forest animals, including monkeys, gorillas, chimpanzees, porcupines, and certain species of deer or antelope. These are often caught and prepared for meals, bushmeat. Outbreaks in the past have typically been in rural forested areas, or have always been in rural forested areas until the present outbreak in West Africa, which has involved urban populations. How is this disease transmitted? Ebola virus disease is transmitted through direct contact with blood or bodily fluids from infected persons or animals. On the African continent, killing of infected animals for bushmeat is the main way in which the virus makes the jump from forest animals into human populations. Once people become infected, the virus is passed from person to person by direct contact with the blood or the bodily fluid of ill persons, including urine, vomit, stool, and semen, or with the bodies of persons who have died. Ebola virus is not transmitted through casual contact with well persons, through water, through air, or properly cooked meat, that it is not spread by the bite of mosquitoes. High-risk activities for contracting Ebola virus include caring for ill persons with the disease, traditional funeral practices that involve handling of bodies of persons who have died of the disease, or contact with items or surfaces contaminated with the bodily fluids of a person with Ebola virus disease. Ebola virus can be transmitted in the semen for up to 7 weeks after a patient's recovery from Ebola virus disease. Because of the manner in which it is transmitted, healthcare workers are at particular risk. What are the symptoms? Persons affected with Ebola virus disease take between 2 and 21 days before symptoms begin to show up. But on average, symptoms begin about a week, 8 to 10 days after exposure. These symptoms include fever, severe weakness, intense body pains, and sore throat. They may be followed by vomiting and diarrhea, and in some cases, bleeding under the skin or from the nose or mouth or other openings of the body. How is it treated? There are no licensed Ebola-specific therapies at this time. The World Health Organization has deemed it ethical to use certain experimental treatments where they are available, but these are in extremely limited supply and are not available in the Caribbean in these early phases of production. The treatment of Ebola virus disease, therefore, is largely supportive and focuses on replacement of fluids lost through bleeding, vomiting, or diarrhea, and provision of nutrition and alleviation of discomfort. Approximately half the persons treated in this way survive in this current outbreak. How can it be prevented? There is currently no vaccine available to prevent the transmission of Ebola virus disease, but development work on that front is ongoing, and some trials in monkeys show promise, with protection from the virus being generated for many months after exposure, after vaccination. For the time being, therefore, prevention consists of avoiding all contact with potentially infectious body fluids, objects, or surfaces. High-risk activities should be avoided. Persons who may be ill will need to be taken care of in a healthcare setting. Relatives of ill persons are advised not to attempt home care. Within the healthcare setting, it's important that patients with Ebola virus disease are treated in accordance with strict infection prevention guidelines using appropriate personal protective equipment. The virus, however, is not a very tough one. It is easily inactivated by common disinfectants. Surfaces and reusable objects that have been contaminated with infectious body fluids may be cleaned by appropriate concentrations, for example, of diluted bleach to prevent transmission. How is it diagnosed? Because it is extremely contagious and highly lethal, the Ebola virus disease is only diagnosed in laboratories equipped to maintain the highest possible level of biosafety. Those are called biosafety level 4. This is what's called a category 4 pathogen. CARPHA does not have a BSL-4 laboratory, and there are no BSL-4 labs in this region. Samples are therefore not to be sent here. Arrangements are in place with the assistance of the Pan American World Health Organization for samples from CARPHA member states to be received by the U.S. Centers for Disease Control in Atlanta and the Public Health Agency of Canada, which are WHO collaborating centers in the region of the Americas. What is our regional assessment of risk? The current outbreaks of Ebola virus are limited to Central and West Africa. The animals which carry this disease are not present in our part of the world, the forests of the Caribbean islands. There have not been any cases of Ebola virus disease in the Caribbean. The overall risk assessment remains low risk for the Caribbean region. Be that as it may, this is not a time for complacency, because of the consequence of an imported case, though unlikely, could be serious for the health of our residents and for the tourism industry in the Caribbean. CARPHA continues to monitor the situation and advises its member states to continue their efforts to attain a high level of preparedness for the possible, though unlikely, introduction of a case to a CARPHA member state. Please note that this level of risk may change as the situation changes and new information becomes available. The key elements of preparedness. While the risk of introduction remains low, it is important that each member state take the opportunity to ensure that several mechanisms are in place to mitigate the potential impact of its arrival. These measures are included in what's called the International Health Regulations, or IHR, that came into force in 2005. They include appropriate communication messages to be disseminated to the general population, to travelers, and to health workers and educational institutions, ensuring that people know how to reduce their risk and what to do if they suspect they're ill or exposed. They include strengthening the systems and ports of entry to handle travelers from countries where Ebola virus disease is in circulation, and to provide advice to travelers arriving from these countries. The international health regulations include also review of available infection prevention and control guidelines and procedures for Ebola by people within the healthcare system, and the acquisition of appropriate personal protective equipment. So this is key. We will have other problems beside Ebola in the future. Achieving compliance with the international health regulations is the way to be able to prepare. What is CARPHA doing to bolster regional preparedness? CARPHA has undertaken a series of initiatives aimed at helping to enhance the preparedness of its member states to deal with this threat. These include the establishment of an incident management team at the CARPHA headquarters to facilitate coordination of the regional response. We've executed several video and teleconferences with chief medical officers, with epidemiologists and laboratory directors, providing situation updates, guidance and preparedness, and answers to questions and queries alongside PAHO WHO and the US Centers for Disease Control. This arrangement, in conjunction with PAHO WHO, of access to testing facilities at CDC and the Public Health Agency of Canada for confirmation of cases. The provision of information and guidelines on our website, which is updated weekly. The provision of media updates through press releases and media conferences, including this one, and the provision of ongoing consultation with member states as they work to strengthening their individual abilities to respond. CARPHA will maintain the efforts to keep the Caribbean public apprised of the developments in this area as they unfold, and will continue our efforts in facilitating the development of our regional preparedness with the threat of Ebola virus disease. Thank you. The floor is now open for questions, which will be handled by myself or Dr. Olokure.
Jerry George. Jerry George, Ireland. It's okay? Yeah, Jerry George, Island Media from St. Vincent and the Grenadines. You mentioned the international health regulations compliance. I have a little bit of concern as to what is the stance of the IHR with respect to banning people from areas that have been affected. At least one country, St. Vincent and the Grenadines, have gone that route. Is that in compliance with the IHR?
At this time, the World Health Organization is not recommending the restrictions on travel from people from affected countries. People from affected countries, those governments have implemented exit screening procedures to pick up if anyone has been in contact with, been to a funeral or is sick. However, member states are sovereign. They can, if they wish, put in place such measures. But WHO, no CARPHA at this time are recommending those measures.
If you could just tell us in terms of the local measures that have been put in place, we should have, a few weeks ago, the National Operations Center they had two press conferences thus far, indicating that they've set up special areas at 4 and normal hospitals. We've had one person coming in who checked into a private facility, and the health authorities were being contacted. It turned out not to be any, it was just a sphere, if at most. Can you comment on the measures that we have in place here and the standard in terms of what's happening, and was CARPHA consulted in terms of those measures being set up?
We don't comment on the situation in individual member states. What I can say is advice that's provided to all member states about the measures that they should have in place, including, again, ports of entry, having strict infection prevention control, procedures in place, appropriate levels of personal protective equipment for staff, training and orientation of staff. We do provide guidelines for all of those, and they're available on our website, including guidelines for travelers who are coming from affected areas.
If I could also just add to that. Again, we believe that scares, as you've said, are also good for the system, because what they show us is that the system is working, but there is a level of alertness with regards to the potential for cases to arise, and therefore test the system and then allow us to see potentially what gaps there might be and then how those could be filled. And this is what we would recommend to all the member states, that following a scare, there should be a lessons learned exercise then to see what is needed in terms of preparedness moving forward. Thank you.
All right, Dr. Hospital is just moving away now from, I know my general spot now, just locally address Chikungunya statistics. Yesterday your website only had that there were 5 cases in Trinidad and Tobago, and according to the chairman of the Regional Corporation, they confirmed 34 cases in Delmartin and 6 in Belmont. Can you all give us a final figure, a definitive figure today in terms of what's happening?
Just want to say that we will address questions on your question on chikungunya a little later, but right now we would like to focus on Ebola. Following the, once we are through with the questions on Ebola, we will address the question that you have and any others on chikungunya.
My question goes back to Ebola, and I was reading an article last night, and one of the things that was said about the distinction between this particular incident and the previous incidents was, one, the timeliness of response by the health organizations, and secondly, it had to do with the question of quarantine. At all of these islands, do we have an area that has been designated a safe area for quarantine? How do we plan to deal with that if somebody does come down with this disease? And what are the requirements for a quarantine area?
Thank you very much for your question. And again, when we talk about quarantine, this is a means for us to keep people who are potentially suspected of having Ebola virus away from the general population, and therefore to protect the population from potential risk of infection. With regards to if we talk about the IHR, so the IHR does require member states to have identified areas for quarantine with this type of event in mind. As far as we are aware, overall, within the region, again, there is clearly some room for improvement in terms of that. The individual member states have been in the process of identifying what are safe quarantine areas for potential people who they identify may have Ebola virus infection or may be coming from an area where there is a current outbreak. And so therefore the member states have already identified or are in the process of identifying those particular areas. The requirements clearly are to ensure that this potential person is not able to infect others if they are identified as having the Ebola virus. Also, again, ensuring the protection of the healthcare workers and other people who come into contact with this person. Also ensuring that there is the ability to be able to do contact tracing. So although you put that person into quarantine, of course, you have to go backwards and check where they've been, who they've been. So again, that needs to also be available and in place. We should also bear in mind that potentially people will arrive to the islands by air travel. And again, because the Ebola virus is not airborne, then there is unlikely to be transmission within the airplane. And so therefore, that is an area where we can say transmission is likely to be low. However, again, there would be the ability to trace contacts who were on the plane who were sitting close to the person if required. In terms of, again, quarantine, so if we look at some of the member states, what they have done is identify areas within the airport for moving those people to, or they are actually providing what we would call maybe containers or building bespoke areas close to the airport so that person can be moved to that area, have a medical examination, and if deemed necessary, then they can be transported to a healthcare facility directly from that point, and so therefore they do not come into contact with the general population within the airport setting.
Follow that up by asking, you mentioned earlier about the question of scare. The very first scare that came to Trinidad came from a plane that had traveled from London to St. Lucia and then to Trinidad and Tobago. Am I correct? Now, the incident was highlighted in Trinidad after that plane had been to St. Lucia and then to Trinidad. To me, why weren't the people in St. Lucia aware that this possibility existed if Trinidad could have picked it up hours later and possibly have contaminated people in the process in St. Lucia?
Thank you for that. It's very difficult to comment on that individual incident. To the best of our knowledge, there was a notification from London to the people in St. Lucia as well as Trinidad, and so therefore it depends on the timing of that, it depends on who received the message. It's very difficult to comment on exactly what happened with that particular incident. And again, what we do know is that following that incident, clearly alert levels are raised, and we are again able to move forward in terms of our preparedness activities, and so therefore prepare for something that may happen or be similar in future.
May I invite persons from the regional media, if you do have a question, please unmute your microphone and proceed with your question. Identify the media house that you represent and please state your name. I now invite persons from the regional media. If you do have questions, you may go ahead.
Ms. Mendes, thank you very much for your question. I'll give you a very brief summary. Can the document be sent as well? Yeah, okay, great. Okay, so I'll give you a brief summary. So CARPHA is actually playing a very coordinating, playing a catalyzing role in terms of ensuring preparedness across the region. So if I start first with, we have set up what we call an incident management team, and the incident management team is one that comprises several members who are multidisciplinary in nature, both epidemiologists and laboratory people, as well as the communications team. And what that team does is to actually then coordinate the response to Ebola virus disease within CARPHA member states and across the Caribbean. We have also had teleconferences together with the CARPHA member states, as well as with PAHO, WHO, and the US CDC. And this is to provide advice and guidance to our member states with regards to Ebola virus disease, to provide them with updates on the current situation in West Africa, and also to share with them our risk assessment as well. We have also provided a number of guidelines on our CARPHA website, and again you can go and visit the CARPHA website. That also then provides links to other websites, mainly the WHO as well as the US CDC websites, where you can obtain further information or more detail on the situation as it unfolds in the African region. CARPHA has also been in discussion. We also provide advice and guidance to the member states as well on an ad hoc basis, so to speak, in that they would either email us or call us with concerns that they might have, and we do then respond to those or provide them with direction in terms of where they might find further guidance. CARPHA has also been working together with PAHO WHO, US CDC, and the Public Health Agency of Canada to provide access to laboratories, which are specialist laboratories, the biosafety level 4 laboratories, of which there are none currently in the Caribbean region, but US CDC has one and the Public Health Agency of Canada have one, and we are facilitating access to that for the CARPHA member states via PAHO WHO. Okay. I think that covers most of them. We will send you the document that we have as well, and you can have a look at that to gain some more information.
Hello, good morning. I take it I've been heard?
Yes, we can hear you.
Okay, I am Peter Richards from CMC here in Barbados. A question for Dr. Hospitalis. Dr. Hospitalis, I know we're focusing on the Ebola virus, but we are also hearing reports, particularly coming out of Grenada, that there is a possibility of the West Nile virus. Can you confirm or put, at least for our viewers and subscribers in Grenada, that this is not the case, or we do not have any such case in the Caribbean?
Thank you, Peter. If there are no more questions on Ebola, are there any more questions from the floor on the Ebola virus disease? Okay. Well, we did have a question on the Chikungunya virus and the support from the Guardian, and maybe we can address that question first. Following that response, Peter, we will address your question on the West Nile virus. Lisa, would you like to repeat your question?
Dr. Hospitalis, I'm not sure who's going to take the question. We just want to get a confirmed figure as to how many cases we do have in TNT and what happens to, because the regional corporations themselves should take the lead in cleaning up their respective communities, but in terms of advising the ministry and what else can be done, because it seems to be spreading very quickly locally.
Thank you very much. I'll respond to your question. Now, in terms of the numbers, the Ministry of Health has quoted a certain figure that we are aware of, and we have a certain figure on our website. Now, if you look at the CARPHA website, you will note that we provide information on the week of report. And so if you look at the week of reports there, that is the week of reports when we last had official information from the Ministry of Health. So what CARPHA does is CARPHA provides official information. We are aware of the reports that have been made in the media, but we cannot use information that is quoted in the media until we are officially notified by government that this is the official figure of cases that they are reporting. Now, I think if we look at what needs to be done in order to control chikungunya, then that really is not about the number of cases or where those cases are located. It's a case of everybody in every community and every individual needs to take responsibility in order to ensure that their environment is clean, that their environment is clear of waste materials, that their yards are clean, that they don't have standing water either in drums or in old bottles or discarded rubbish lying around in the yard. They need to be covered and protected, if you have flower vases or flower pots which have standing water in them, those should be cleaned or emptied at least twice a week in order to ensure that you don't provide a breeding site for the mosquito. And clearly, we also know that this mosquito bites during the daytime. And so therefore, it's very important that people protect themselves, as I can see many have done here today, by wearing long sleeves and long pants. Yes? I know you're laughing, but it's true, yes? And so therefore, that's part of what is recommended, as well as using then insecticide repellent, so mosquito repellent as well, so using that. And then just also being aware of your environment as well. And these mosquitoes, they will bite during the daytime. They bite indoors as well as outdoors, and so we should also note that as well. And so therefore, at home, potentially you may wish to use some other means of protection, and mosquito nets may be used. Alternatively, especially we would recommend insecticide-treated nets. But alternatively, if you do have air conditioning, these mosquitoes, they don't like the cold. And so therefore, they are less mobile during, if you use an air conditioner at night. I know not everybody is able to do that, but then again, a mosquito net is very, very useful to protect yourself.
Sure, I'll just identify the media house you represent, and that is your name again, please.
Lorraine is guys radio. Earlier this morning, there was a report in local media in Jamaica that CARPHA has stopped testing for chikungunya due to the overwhelming number of cases in Tobago. And I quote, CARPHA Director Dr. James Hospitalis was also said to be busy and messages were not returned. The story was quoting a report in the Trinidad newspaper that Trinidad was overwhelmed that CARPHA is no longer testing for chikungunya or dengue fever. Can you comment on that, please?
Thank you, Lorraine. CARPHA's testing policy follows public health principles. And so our current testing policy on chikungunya and dengue is as follows. We test from newly affected areas of a country in order to confirm that the virus is present and circulating in that community. We test people who are severely ill and in hospital, and we are testing for the chikungunya and dengue for pregnant mothers who are suspected of having these diseases. CARPHA has not stopped testing. This has been the policy in place from the beginning. What it does mean is that we don't test every single case. We don't have the resources for that, and from a public health point of view, it is not necessary. Once the disease is confirmed in a particular community, then the prevention measures, such as Dr. Olawokure was just outlining, can go ahead. It doesn't have to wait for a confirmatory test from the laboratory. But I repeat, CARPHA has not stopped testing. We have faced a big increase in testing, and we've scaled up our capability to do that. We're supporting the whole Caribbean. The regional airlines participate in the transport of specimens, and we test to confirm the presence of chikungunya and dengue in newly affected areas of our country. Once that is done, then we don't accept specimens from that area, unless it's somebody who's severely ill, or it's a lady who's pregnant. Thank you. Or hospitalized case.
To follow up on that question, you just qualified what the test means. But often you see countries, for example, Barbados last week put out that there are 11 cases. When I looked at your data, the only country that had anything close to reality was Dominica, some 5,000 and something cases. Is there such a thing as a profile for disease, so that when a particular disease, for example, a doctor doesn't test every person who comes down with dengue, they make the declaration that there is dengue. So haven't we arrived at that stage in the region where doctors should, with the information that they have a profile on this disease and simply send that information to maybe some local, the Ministry of Health in particular, so that we have a proper sense of what the numbers of this disease really is? Because right now, when I hear people tell me we have 34 cases, when, in my own experience, what I've seen happen is that once a case gets into a house, the entire household comes down with it. How are we reflecting the truth of the incidences?
That's a good question.
Okay. Thank you very much for that question. Now, you are correct that once we have a lot of transmission of chikungunya, then the clinicians have the responsibility to identify, not necessarily using a test, but recognizing that there are certain features of chikungunya which would then point them towards that diagnosis. And that is actually what is happening in reality on the ground. Now, again, in terms of identifying the real numbers, epidemiologically, when we look at a public health issue, particularly a communicable disease such as chikungunya, we recognize that there will always be an underestimate of the numbers precisely because of what you have said, which is doctors make a diagnosis but do not do a test. And so therefore, there are what we would call syndromic surveillance systems, and one of those looks at what is called undifferentiated fever along with other symptoms in order to get an idea of the extent of the disease within a particular country. And so those systems are in place with a number of countries, so we can see what is the general picture and then have a clear idea of what is really happening. However, that doesn't specify chikungunya. It could be chikungunya, it could be dengue. Yeah, so that is one potential problem with that. Clearly, in order to identify every individual case, that takes resources, and not every country has the resource. Even in developed countries, such as America, I should say, let me rephrase that. Even in countries with more resources, such as America, the UK, Canada, they also will not test every individual case once you get beyond a certain number. Then it's down to the clinician to identify. But it is, again, how we implement the prevention and control measures that we know work. And that is really what the focus should be now. Now that we know chikungunya has arrived, member states were asked to prepare and then to implement their prevention and control measures. I'm sure people have seen the environmental health people going around doing the fogging. You have seen various other activities which are directed at reducing the ability of the mosquito to propagate itself and therefore to pass on chikungunya. And again, as you say, individual households may well have more than one case. And again, we have seen that happen. But it's about how we as individuals and communities then protect ourselves and our families from being bitten by mosquitoes which transmit this disease. And so therefore, again, as I've said earlier, the responsibility is on us as individuals. It's also on our communities in order to protect ourselves from this particular disease.
Hi, Natasha Chu. Natasha Chu from 5.5. We have had reports of persons saying that they are getting symptoms of the chikungunya, and instead of being tested for that, they are instead tested for dengue. Now the problem with that is that there are certain medicines that can be used for dengue that could possibly worsen chikungunya.
So didn't hear the last part.
Okay. Medicines that can be used for dengue can possibly worsen the chikungunya disease.
Okay. Sorry, can I just check? Your last part was a statement or a question? Okay. So what we have is a situation where the initial symptoms for dengue as well as for chikungunya they can be similar. And so what you will get is that you'll get that sort of that fever, maybe the lethargy, muscle pain, joint aches, and then potentially a rash. And again, with dengue, you can have those symptoms as well in the initial early stages. And so that is why physicians test for dengue first. Yeah, because dengue is what we would call endemic within the region, and it's more common than chikungunya at this time. And so you check for what is common first. And dengue is most common, so what you want to do is to make sure you exclude the diagnosis of dengue first, and then you go for chikungunya. Now, we do not have any reports, as far as I'm aware, that medicines for dengue would interfere with treatment. And as far as the literature shows, that does not happen. Now, clearly, what you want to do is, because potentially dengue can also be a very, very serious disease, you want to make sure that if it is dengue, if they do test positive for dengue, you go straight away and you can then treat that person for dengue.
Just an additional comment on some of the features that differentiate these diseases, although they're similar. Fever and cough is pointing to something respiratory like flu. You may have aches and pains, but if you have cough, it's flu. Fever and body aches without the respiratory is more likely to be dengue. The hallmark of the chikungunya is fever and joint pains and joint swelling, and like an arthritis, and that does not occur in dengue, and that's what's typical of the chikungunya. In a country where the chikungunya is spreading over a period of several months, that will actually, because nobody is resistant to it, that will become the commoner of the two conditions. We're early in a situation, for instance, Trinidad and Tobago, where it's still in early days, it's more likely that somebody might have dengue because the country is endemic to dengue. But those are the sort of differentiating tips between the three common conditions that present with fever and aches and pains: flu, dengue, and chikungunya.
Hi, Anita Boucher from TV6 News. We know that dengue has a mortality rate. I just want to find out if there have been any deaths so far across the region from the chikungunya virus, and if not, do we really need to be in such a panic as with the dengue virus?
Thank you. That's a good question. Deaths from chikungunya, a total across the region of 37 have been reported. For the most part, in people who have previous severe medical conditions, diabetes, heart problems, and so on. And so therefore, we don't need to be, as you're saying, in a big panic. But there's need for concern for two reasons. One is because nobody is resistant, you can have a large number of people affected in a short time, in a matter of just a few weeks or months. And if you have a high percentage of the population affected with something that takes them out of the workforce for a week or two, you face a temporary economic disruption. More NIS payouts on a day-to-day basis. If you run a business, you're not sure who's coming to work today. If you run a healthcare facility, you're not sure if the doctor or the nurse is turning up today because they have this problem. So that's one of the reasons there has to be a high level of concern. The second reason for a high level of concern needs to be there is we live in a primarily tourism-dependent region. So if there is uncontrolled spread and there is a lot of worry, then it may actually result in decline in tourism arrivals. So there is a need to balance the concern and the fear with judicious action. It's not something to be taken lightly. In the Indian Ocean, a few years ago, where they had big outbreaks of chikungunya, they had substantial downturns in tourism, 30% downturn. The Caribbean, no Caribbean country can afford that. So those are some of the reasons why no need to panic, but need to be concerned and take all the measures to prevent spread, as has been outlined by all the ministries of health and on the CARPHA website.
This is September. Oh, sorry.
Good morning, Chikungunya Express. My question is to Dr. Hospitalis. We had some PAHO stats, and they said that there have been 90 confirmed cases of chikungunya. So I just wanted to get some clarification on that. Thank you. In Trinidad, locally.
How many?
90.
Yeah. PAHO had some stats, and they said they had 90 local cases.
90 or 19?
90.
check the PARO website on a daily basis. We're not aware of that number for Trinidad. Yes.
I go back to the question on the tourism impact. I saw yesterday, I don't know if this is official, but in Grenada there's a figure of $50,000 paid out from the NIS. How do we know, as a tourism region, how this is impacting the sale of our tourism product? Because that's a very serious issue, especially in economies, most of which are not like Trinidad and Tobago, but have deficit financing issues. How do we know how this is being projected and what impact it is having on the tourism market? Is there any way that we can find this out?
Thank you. That's a good question, given the tourism-dependent nature of the economies of the Caribbean. So from much earlier in the year, we have been in a lot of contact with the Caribbean Tourism Organization to raise this concern. I attended their board meeting in June in New York to flag the issue with the tourism sector. You may be aware that the tourism figures for the first 6 months of the year show a slight increase in arrivals, which is good. I was never too worried about last season. I'm a bit more worried about the next season. We have asked Mr. Riley at CTO to prepare an analysis of the potential economic impact if there's a downturn in tourism. And at the State of Industry Conference next week, we'll be engaging with tourism ministers and other stakeholders to stress some of the prevention issues that need to take place, making sure the properties are not breeding mosquitoes, provide information for staff and for visitors, indicating what they're actively doing. One of the ways to avoid the panic is to be clear about what are the proactive measures being taken to rid the property of mosquito spread, inform guests. Guests know they're coming to a tropical area. I think pretty much the US, CDC, Public Health Agency Canada, the UK talked about exercising precaution to avoid mosquito bites, or exercising enhanced precaution. So we work as well closely with US CDC, with Public Health Agency Canada, and with the UK to make sure that those kinds of messages are transmitted. So we have an expert consultation on Chikungunya coming up, trying to pull it off in October, which will also invite, towards the end, all the stakeholders from the tourism sector, from media, from business, to look at what together we can do to protect people and to protect the economies of the region, which are so tourism dependent.
Where will this meeting be held?
The meeting will be held in Port of Spain, Trinidad and Tobago.
If there are no more questions on Ebola and Chikungunya, I would like to ask that we respond to the...
That's not it.
Okay, we'll have one more question from Ms. Boucher, and then we'll go to the West Nile question from Peter Richards at CMC, and then we'll wrap up.
Okay, they were talking about eradicating, doing the mosquito eradication, but dengue has been around with us for quite a while. So is it safe to assume that the Chikungunya virus would also remain with us?
It's a very good question.
Very good question.
Before Chikungunya arrived, and as it arrived last year, we anticipated there would be spread. Because nobody was resistant to this population, because of the abundance of mosquitoes in all countries, and because of a lot of travel. The experience elsewhere in the world where Chikungunya was not present and then arrived is that when it comes to stay. So it becomes what's called endemic, and you get ongoing transmission at a lower level than the initial big problem. It goes down, but then it continues year in and year out. And that will be a change in the pattern of illness that this part of the world has been experiencing. And the Americas, we're really in the early stages of the whole story of Chikungunya in the Americas, in Central America, in Latin America. It remains to be seen just how it will pan out. But it is likely that it is here to stay. It is part of the reason we're having the expert consultation. The fact that dengue has been going up steadily for 20, 30 years now, and with more frequent epidemics and with more severe cases and deaths is a flag that what we have been doing, what all of us, not just the government, all of us, what we have been doing has not really been working. We have a solid waste situation where mosquitoes breed everywhere. Drums, guttering, they mentioned some of them earlier. Tires, Kentucky Fried boxes, bottles, they breed all over the place. But drums are the #1 source in most of the Caribbean. So with that situation, we need to look again at how we deal with this, how we deal with it. Maybe we will be going back to insect screens on doors and windows. So that's partly why we have the consultation to put together all the latest science and evidence around it. There is some promise around a Chikungunya vaccine, but again, it's early days. Vaccines take a long time to develop.
Is there, just to Peter Richards' question, is there potential threat for West Nile virus in the region?
In response to that question, I think, as far as we're aware, we have had no reports of West Nile virus. I think it was from Barbados, he said?
Grenada.
Grenada, sorry, from Grenada. However, yes, West Nile virus is a potential threat to the region. And again, it's another disease which we have to be aware of and which we should be prepared to deal with. It's borne by, well, only borne by mosquito-borne disease, and it's very clear.
Okay.
So, to follow it up quickly by asking, given the fact that it's a virus or a health situation that we have to be aware of, is CAPRHA informing regional countries to look for that possibility? Because as I pointed out, from Grenada, we've been told by some health officials that there's the possibility of that virus already in Grenada.
We are in the process of preparing what we call a regional health security plan. And within that, we would be encouraging our member states with regards to preparedness for what we would term all hazards. And so this would include mosquito-borne viruses. Again, dengue and chikungunya have been mentioned here, and there are a number of others as well. And so within that, yes, you would include West Nile fever as one of those that countries or CARPHA member states should be prepared to deal with.
And just quickly, what would be the symptoms of the West Nile virus?
With regards to West Nile virus, you would have similar symptoms to what we've been discussing here today. And so again, fever would again be one of your more prominent features, and this is what you should be really on the lookout for. And so if you have somebody with an unexplained fever, you would then want to be checking the other potential symptoms that they would have. And again, they would be initially non-characteristic, such as lethargy, maybe body aches, and those, again, you would need to do a test, and there is a specific test for West Nile fever. You would have to clearly exclude dengue, which is, again, as we've said, more common, and exclude chikungunya, and then you would test for West Nile virus, assuming those facilities are available.
Thank you very much.